Dr. Scher, how we doing today?
Hey, I'm great, Chris. Thanks for having me on.
Yeah, thanks for coming on. It's I think the first time I ever started following your stuff, it's been a few years now, but it was all of cholesterol, lipids, cardiovascular disease. I think it was actually I was writing the Keto Answers book, and I had this section that was all about cholesterol that I had to write, and I referred it was like you and Dave Feldman were like the two guys that I went and watched as many videos as I could because you guys were like the only ones at that time that were saying anything different from like the standard narrative. And so is you've definitely taught me a lot. But now I think it was Low Carb Denver a couple months ago. I ran into
Right?
you and you had mentioned a new product or project that you're working on with Metabolic Mind, which is seemingly kind of in a different direction. So I'm really excited to kind of get into that with you today. So what is going on with Metabolic Mind, and how did you kind of take this shift from cardiovascular and cholesterol to this brain health and metabolic side of that story.
Yeah, it's a good question. On the surface, this seems like a complete left-hand turn and completely unrelated. But when I start to think about it and explain it, it actually kind of makes more sense. And that's how I saw it at first too. Like that's not for me. That's completely out there. But no, it totally makes sense. So first, Metabolic Mind. It's a nonprofit initiative of Bazooki Group, and we are really exploring and sharing resources at the intersection of metabolic health and mental health. And there's this clear connection between metabolic health and mental health, but it's not really taken off in the world of psychiatry, in the world of mental illness, in the world of mental health. So, what we're trying to do is draw attention to it, what exists in terms of what we know and what we don't know. And we're helping fund research along the way and helping just sort of, I guess, promote or discuss the work that other people in this field are doing as well so that everybody can learn. And it really comes back to, Jan and Dave Bazuki and their personal experience with their son, Matt, when he had bipolar disorder. And they just, despite the best treatment, the best resources, the time and the energy to devote to his treatment, he wasn't getting well. And Jan is, I mean, when she gets into something, she's a bulldog and she's not going to stop until she finds something that works. And thank goodness for that. So what she eventually came across was nutritional ketosis by interacting with Dr. Chris Palmer, Dr. Georgia Ede, and others, and got Matt on a ketogenic diet. And that's really what sort of completely changed his treatment. And it wasn't until that point that now he is better. He is, what she likes to say is normal, that he has absolutely no evidence of mental illness and is better than he ever was. So Jan and Dave and the Bazookies, being so generous and philanthropic, said, we don't want anybody to have to go through the same experience we went through. We want to have a site where you can easily go and just learn all about this metabolic and mental health connection. So that's what we do at Metabolic Mind. We have a YouTube channel, we have a podcast, we've got a website, and we've only been around for I guess like 5 or 6 months at this point, but we're really starting to ramp up to help families know that there's hope and that there is this alternative. I don't even want to call it alternative, but there's other means of approaching treatment that is can be used in conjunction with standard treatment to really help people get better from mental illness. So that's what Metabolic Mind is. Now, you started your question is, how does like your cardiologist focusing on lipids and cholesterol end up there? Really throughout my journey of cardiology, I was always focused on prevention, and I eventually became more focused on metabolic health and this metabolic and cardiovascular health connection. And again, at the time, it didn't seem like many people were talking about it. Fortunately, now it's becoming more common to hear about it, but really focusing on the impact metabolic health has on our overall health and our cardiovascular health. So I kind of became a metabolic health expert, and that's when I became the medical director of diet doctor, focusing on ketogenic diet for metabolic health. So then now transitioning to Metabolic Mind, it's really still about metabolic health. It's about understanding metabolic health and how to treat metabolic health, and now how that can relate to psychiatry. But the other part where I think I really can play a role is, why isn't everybody trying this? Why isn't everybody in the world in medicine trying this? Because they're afraid. So many people are afraid that nutritional ketosis is going to automatically give you a heart attack, is going to automatically send your LDL through the roof, is terrible for you because of all the fat that you eat. And all three of those things are absolutely simply not true. So hopefully my background as a cardiologist and my understanding of lipidology and my experience can sort of help lend some credibility to so people can understand that that absolutely isn't true. And I actually just did a video on the Metabolic Mind YouTube page about this, that keto does not cause heart disease. And that's what we want more people to understand, because if you go to your doctor and they're like, yeah, I heard this keto thing might be able to help you, but it's going to give you a heart attack, so why would you even try it? Of course you're not going to try it, right? That would scare the heck out of you. I wouldn't try it if someone told me that. But if instead more people understand, oh yeah, I heard about this keto thing, it might be able to help you, and it's actually probably pretty safe for most people, so maybe you should try it. Completely different discussion with your doctor to then go and learn more. Even if your doctor doesn't know how to start you on it, that opens the door so you can learn more and understand more and decide if it's right for you. So that's my long preamble of how I got from cardiology now to metabolic mind, but I think it's a good fit.
It is. No, and that's actually an incredible the way you laid that out, because I think you're exactly right. Like, who better for the job than the person who's going to be able to kind of bust a bunch of the myths and the, kind of the pushback that people are going to have against this treatment. Because, I've heard this with a lot of different things where, I'll get comments on social media where people be like, oh, I'm using a ketogenic diet for this thing, but I'm worried about doing it long term because of heart health. Right. And when it comes to some of
Yeah.
these, these brain related psychiatric disorders, this is a long-term thing. This isn't like, you can follow this for some period. Well, and maybe that's a question that I should ask you, but I'm assuming that this isn't necessarily one of those things where you follow it for some period of time, you fix the problem, and then you don't have to do it anymore. Like, I imagine that keto is probably a long-term solution for these people. So, what I think what would happen in most cases is that, let's say if you were, we had Dr. Palmer on the podcast, and he's, coming from the
Yeah.
psychiatric side of things. And let's say, you go talk to him, and then you have concerns about the heart health, and then you have to go talk to a cardiovascular doctor. And then you're going to end up hearing a completely different story about how that's bad for you. So I think that's amazing that you're kind of being able to cover the down, or what would be perceived as a potential downsides, to kind of bust some of those myths. I'm curious,
Yeah.
it's the other part that you brought up about how it was a kind of a natural progression for you, because you're focused on metabolic health, and then we realize now that metabolic health is playing a major role in brain health and psychiatric disorders. And that it was one of those things where I kind of started seeing the connection between metabolic health and all of the chronic diseases that are out there a couple of years ago as well. But psychiatry was one area that it just didn't seem even possible that it could affect that, right? Like, psychiatry felt like something that was more genetic, or it was something that, like, a lifestyle change really wasn't going to be able to be a solution for. And I know there was, at the time, there was a few studies that were showing that keto was maybe helpful, and like small studies with like schizophrenia, PTSD, things like that. But there was never any clear kind of layout of like, here's the mechanism of action of like how this is actually able to help. So then you were left kind of guessing of like, oh, okay, well, is it they're just generally cleaning up their diet, so maybe they're just getting kind of some wraparound benefits from that, or maybe it's the gut health that's maybe being improved here, and that's playing a role. What is it about keto that, I mean, I'm assuming now it sounds like there's a little bit more research. What is it about keto that's actually able to help for some of these conditions like bipolar that you brought up?
Yeah. Well, and the first answer is that we don't know 100% certainty what it is, and it's likely more than one thing. And we have to be honest that we are very early in the research side of things. And this is one of like such interesting balance of the position we're in at Metabolic Mind, where we want to talk about the research, but at the same time, we want to help somebody who needs help now, who doesn't want to
Right.
wait for the 1,000-person randomized controlled trial that may end up being published 5 years from now, right? They need help now. So you have to have that balance. So, but when it comes to mechanisms like you're asking, a lot of what we know comes from epilepsy literature about how nutritional ketosis affects the brain, and it changes hormone or neurotransmitter balance with, like, increasing GABA, decreasing glutamate. It decreases neuroinflammation and oxidation. And if you had Chris Palmer on, I'm sure he talked all about mitochondrial function and how it can improve mitogenesis and more mitochondria, and just how the mitochondria produce energy. And this different energy supply with ketones, which the brain can use more efficiently than glucose, especially for someone who has insulin resistance. So it really is sort of a combination of mechanisms. And one thing I like to say is that nutritional ketosis is just good for brain health. And it sounds vague, but it's sort of purposely vague, because It can help with seizures. It could potentially help with, dementia and cognitive decline, and it can help with schizophrenia and bipolar disorder. And like you said, PTSD or OCD and severe depression. So it's not that you have one center of your brain that is your depression center and one center that is your, PTSD center and one that's your seizure center. But if you can improve the functioning of your brain, this energy disorder that's going on, this energy imbalance in your brain, if you can correct that, then things improve. And skeptics would say, well, that makes no sense, because what causes bipolar can't be the same thing as what causes schizophrenia or what causes even seizures, because they manifest completely differently. And that's where the discussion comes down to genetics, right? Is it a genetic predisposition? And that's where you get into genetics and epigenetics. And there is a lot we don't understand, but what we do understand is how the brain improves its function in the ways that I mentioned when it is running on ketones, when you are in nutritional ketosis, when your metabolic health is improving. All those things with brain function improve, and that's likely a big reason why it impacts psychiatric symptoms. But again, the caveat is we are very early in the research, and that's why at Bazooki Brain Research Fund, we are funding more studies, and we are encouraging other philanthropists to come in and get involved, because unfortunately, we don't have big pharma billions of dollars, coming to pump into research so they can market their drug, because we're not talking about a drug. And that unfortunately puts us at a research disadvantage. And the Bazookis have been amazing with their generosity and their philanthropy, but they can't do it alone. So we do hope others hear this message and see what we're doing and say, wow, it would be great to have bigger studies, broader studies, longer studies, because that's how we change clinical practice. Right now, the people who are most interested are finding us. But how does the psychiatrist who is too busy to even look for this thing, how do they know that this exists and it's something they can use with their patients? That's where we need more research and change clinical guidelines and clinical care.
Yeah. And I think you bring up a really good point there too about how, you always get pushback whenever you're bringing something new to the table about, like where's the randomized controlled trials and all these different things. We get it a lot on the nutrition side too. Like, seed oils is the one that comes to mind, where everybody will say like, well, where's the randomized controlled trial that's showing that seed oils are bad for you? Well, it's like, well, who would fund that? Right? Like there's not a lot of, I mean, like you said, thankfully we have folks like the Bazooki group that are willing to, put money in to do something like this without the idea of a return in mind, right? This is just to actually help and progress this field forward. But there's not a lot of people out there. Well, I shouldn't say there's not a lot of people out there, but most of the people who are funding research are looking to fund research for some sort of gain for themselves. Like big pharma is funding research so that they can get approval for a drug that they can then sell, right? So it's like they have, and for anybody who's not familiar with kind of the research side of things, it's very expensive to run a study. Even a small pilot study is very expensive, and it's not something that you can just pay out of your pocket to do. And even at like a university, like it's not like the college is just waiting to hand you a fistful of cash that you can use to run a study. Like you have to go out and get that money, and the best place to go get money is from people who have money that want to see a return on it, right? So I think it's important for people to realize that just because there's a lack of research on an area doesn't mean that there's no credibility to that area or that it's not valid. In fact, it may even be the opposite, that maybe there's a reason why there's not research in that area, and it's an area that we should look into. Is kind of how I would kind of push back on that. You made a mention early on there about Jan's son. It's Matt, right? Is his name?
Yeah, right.
Matt. So you said that Matt would consider himself normal now. Now, when you say normal, do you mean kind of normal in the sense that he feels the same way that he felt when he was taking medication, and he doesn't have to take medication now, or does he feel normal in the sense of he's feels like he doesn't have any sort of condition, and it's like what is that is like? And I guess kind of the broader question is that is ketosis and the ketogenic diet simply an alternative for the medication, or is it actually fixing kind of like a root cause that's going on in the brain?
Yeah, great question. Great question. So the term normal or abnormal is sort of a judgmental term, and I use it because Matt and Jan use it knowing that it's a judgmental term, but they use it almost like tongue in cheek. Like he says he's more normal than any of his friends. Basically meaning like he has absolutely no stigma of mental illness, no
Mhm.
symptoms at all of mental illness or bipolar disorder. Now he is still on medications, but he's weaning off his medications, and he's doing it
Right.
very purposely and very slowly. We actually have another video at Metabolic Mind on YouTube where I interview Matt and I interview Dr. Georgia Eid specifically about tapering medications with nutritional ketosis. So you asked, is it an alternative so that you don't have to take medications? Well, I don't know that we would promote it as that. If somebody is already on medications, starting nutritional ketosis does not mean they can just stop their medications. There's definitely a danger in that. So that's why we recommend working closely with a clinician, that if you want to taper your medicines, you taper it very purposely and very slowly, very deliberately, and under guidance, because a lot of things can happen. And you can have medicine withdrawal, or you could have a recurrence of your psychiatric symptoms, and you need to know which is which and how to respond to it. But it does appear that nutritional ketosis does treat some underlying cause of the psychiatric symptoms, which then can frequently, not always, but frequently allow a tapering and potentially an eventual cessation of the medications. But again, when done properly and under guidance, because when you've been on strong neurotropic and psychotropic medications for months or years, there are consequences to abruptly stopping them. Our brains need to equilibrate. So that's why you should never stop psychotropic medications abruptly. They always should be tapered very slowly and deliberately.
Yeah, I think that's appreciative to kind of bring in that nuance to it. And I think if any of the listeners recall from when we had Dr. Palmer on the podcast, he really highlighted how a lot of these medications are actually further damaging mitochondrial function and worsening metabolic health. So even in the event that a ketogenic diet isn't able to completely remove a medication, is there any possibility that a ketogenic diet could at least mitigate some of the metabolic and mitochondrial damage from these medications?
Yeah, certainly. I guess it's hypothetical at this point, but it seems like it
Mhm.
would. And if you can, cut your dose by 50% or even 25%, you're reducing the potential side effects of those medications. I mean, so many of the psychiatric medications cause people to lose weight. To gain weight and
Mhm.
to worsen their metabolic health. So anything you can do to reduce that medication is going to directly benefit you. But then if the medications are also causing a disruption in fuel usage and energy production, and now all of a sudden you allow your body to use ketones for energy production, that can bypass this need for glucose energy production. So theoretically, that's going to lessen the side effects and the damage as well. So it certainly makes sense that it would work. And it's a lot of things sort of coming together at once, that, as Dr. Eid said, even if someone doesn't reduce their medications, if the side effects from those medications are reduced, then that is a huge victory. Right? We get into
Mhm.
this like drugs are bad, drugs are good, you should never be on drugs. It doesn't have to be so black and white. It's what's going to help this patient thrive and live their best life. And a lot of times in psychiatry, that's not necessarily what we see with treatment. Instead, we say what's going to keep them safe and allow them to not be a danger to themselves and others. But we don't take that next step and say, well, what can we do to help them live their best life and really thrive? And that's where this combination of medications and nutritional therapy can really be powerful.
Yeah, no, I think that's amazing because that's the quality of life is kind of the thing that's removed from patient care a lot, right? It's about keeping people alive. Is kind of what you're saying there, and I think that's the case. You probably saw that a lot in cardiology as well, where it's not about statins. I think is a great example of like we have a fear of cholesterol, and we think hypothetically if we lower cholesterol with a medication, that's going to make somebody healthier. And maybe that is or isn't the case. Like we don't necessarily have to get into that here, but how we know that these statins come with a lot of side effects, right? But so rarely are those side effects ever talked about. A physician very rarely will tell a patient ahead of time these side effects, and very rarely do they actually give them anything to do about them to help mitigate those side effects. And I think it seems like a similar thing here, where you're giving these patients something that's going to keep them alive, going to prevent them from being a danger to themselves or somebody else, as you mentioned. But that's not necessarily a good quality of life. And obviously, I think that's a major component to it. When you talk about the ketosis side of things and how these medications can be further damaging to metabolic health, Is there anything on the medication side that prevents these folks from getting into ketosis, or is it more challenging for them to get into ketosis because of some of the metabolic impairment that's coming from these medications?
Yeah, it's definitely possible. I mean, there
Mhm.
are things that can make it harder to get into ketosis, and something like a carnitine deficiency certainly can
Mm,
make it harder. Um, can some medications make it harder than others? Possibly, and we're learning a lot about that as we gain more clinical experience, and that's something that would be really interesting to see in trials. But right now, we have to rely on people like Dr. Shivani Sethi and Dr. Georgia Ede and Dr. Chris Palmer and Dr. Matthew Bernstein, and there are others, but people who are using this and sort of rely on their clinical experience. And they probably would say there are some people that are harder to get into ketosis than others. But what Georgia Ede said the other day was every single person who gets into ketosis in her practice sees some benefit. And,
wow.
it doesn't mean 100% benefit, but 100% see some benefit when they get into nutritional ketosis. So for her, it is worth doing anything you can to get that person into ketosis because she believes 100% are going to see some benefit. And she can't say that about any medication. Yeah.
Yeah. And that's kind of what one of my next questions was, is that, that question I posed to you is kind of coming from a place of that ketosis is kind of the main driver here of the benefit. And I know you said we're still kind of figuring out the mechanisms, but is it ketosis and the presence of ketones that we kind of believe is the main driver here? And if so, is there kind of an optimal range that we're seeing, something that we're trying to shoot for to get these people to allow them to experience the maximum benefit, or maybe it's different across different conditions, but what's going on there?
Yeah, it's a great question. So I guess the first part is to take a step back and say, look, anybody getting off a standard American diet, getting off a highly processed diet with simple carbs, sending your blood sugar and your insulin on roller coaster rides, anybody getting off of that diet is going to see some improvement, no question. But the next question is that enough? And we did a podcast interview about a case report about a woman, Susie, and her mom, Mary. And Susie has um, Down syndrome, and she had early onset dementia in her early 40s, and she was overweight, and so she went on a paleo diet, a whole foods paleo diet, which is for all intents and purposes a very healthy diet, dramatic
Mhm.
improvement. And she lost weight, she lost like 100 pounds, but her
Wow.
brain did not change. In fact, her cognitive function continued to decline. It wasn't until she got into nutritional ketosis that boom, she improved like that. So one case study, right? One case report, but plenty of clinicians will back that up with their own clinical experience. And there are other people who say that happened to me too. So it certainly appears that there is something special about ketones. Now, improving metabolic health, improving your diet quality, all those things are important. But adding the part of ketones, your brain running on ketones, seems to take it to that next level. And it makes sense. I mean, because following a Mediterranean diet could be healthy, but it's not going to change your physiology. It doesn't change the fuel in your brain. What does that is ketosis. So that's the next step. So that does appear to be one of the main driving forces. Now, the next question is there a certain level of ketosis? And that is a fantastic question that I hope we're going to start learning a lot about. Dr. Ian Campbell in Edinburgh has just completed a study about using nutritional ketosis in bipolar disorder. And part of his study was looking at where the ketone levels and they see an improvement. They're still analyzing their data at the time of this recording, but it's going to be presented in June at the ISBD conference. And I'm really excited to see what they find, because that might be the first signal that is a level of 2 better than a level of 0.7? And I'm just pulling numbers out of the air. It makes sense that it certainly could be, but it also makes sense that there might be some individual variability as well. So this is where I think it really helps to work with someone who understands ketosis and can help you do experiments, right? If you're normally at 0.7 and you're getting some improvement, well, maybe we try lowering your carbs even a little bit more, adding some MCT oil, adding some intermittent fasting. Let's see if we can drive those ketones up to 2.5 as an experiment and see if anything changes. Doing it purposely, measuring, doing it as a true experiment to see what happens. I think that's where you can really understand what works for you as an individual as we're waiting for the research to sort of catch up and help guide us.
Yeah, I mean, to me, that's really exciting because, as you mentioned, there's a lot of strategies that you can take to help get your ketones to the number that you want them to get to, right? So, if we knew that there was a beneficial range to be in, then we could kind of take steps to help get you there. And that was going to be one of my next questions. You brought up MCTs. Do you see any potential for MCTs, exogenous ketones, or any sort of supplement to help increase ketone production? And I'll kind of tell you the reason why I ask that is, and I posed this to Dr. Palmer, and I know he's not maybe the biggest fan of exogenous ketones, but one of the benefits that I potentially see here is, you brought up earlier in this conversation how, we're kind of fighting a battle against big pharma who has a lot of money, and I've always wondered if some form of an exogenous ketone or a supplement that increases ketones, if that would be the driver that would force these players that have, because ultimately what we care about is getting people better, right? Like you mentioned, we want improved quality of life. We want people to get better. If it's going on another medication, as long as that medication doesn't have side effects, I don't know about you, but at least for me, I'm not so against that if it means people's quality of life improves and there's no long-term downside to that. So
Right.
I always wonder, if exogenous ketones or MCTs or some combination of that could be a driving force that would make somebody like Big Pharma or somebody in business minded be like, hey, there's opportunity here. Now I'm going to fund research because I have a reason to fund it. What do you think about those things?
Yeah, I think it's a great point, and it would be a good sort of foot in the door, I think, for some more funding agencies to come in and fund research. Where I'm hesitant is the concept of eat whatever you want and just drink these ketones
Yeah.
and you're going to get
Yeah.
better. And that would probably be the message from big pharma because they want to capture the biggest market in the world, which is going to be
Good
people
point.
who don't want to change their diet, right? So
Hmm.
just drink this drink and you'll be fine. So that's the message I really want to steer clear of. Where I see it would be most helpful is if you are in nutritional ketosis and you're getting the metabolic benefits, the metabolic health benefits of being in nutritional ketosis, then you add the exogenous ketones to bump your level up. That's where I see it as it's being most useful. And I think there definitely could be a broad application there. If someone is at 0.5, 0.7, 1.0, but they take the exogenous ketones, bump it up to 2.5, and all of a sudden their symptoms improve that much more. Like if it improves 70% initially, and now they're up to 90% improvement. Yeah, that's worth it. That's exciting. We don't know if that's the case, right? I'm speaking hypothetically, but you could see a world where that could be the case, and that could be a great in for exogenous ketones and for products. As long as we understand we still want to get the metabolic health benefits of following the diet, doing it through a nutritional component and a whole lifestyle component.
Hmm.
The same concept holds for a keto diet, right? It's not just you go on a keto diet and everything improves. If you're not sleeping, if you're doing drugs, if you're sitting on the couch all day, a keto diet is only going to take you so far. There are still other aspects of metabolic health that are so important, and a keto diet might kickstart it. But then, if you start sleeping, then if you start moving your body, you get off of drugs and alcohol, and now all of a sudden you're going to see this cumulative benefit even more so. So it works the same way with exogenous ketones. Yeah.
Yeah, yeah, that's a good point. That's kind of a big hole in my hypothesis of kind of a way to get funding in is that, because we're kind of seeing that with like the GLP-1s right now, where this diabetes medication's been repurposed for weight loss, and the
Mhm.
idea is that you can just, it's called the skinny shot now. You just take it and you'll lose weight and you don't have to do anything about it.
Eat
And
whatever you
I
want.
was
Mhm.
exactly. You can just continue living the life that you were living before, which is often, I think, most pharmaceuticals is kind of the way that those are poised. Is like, don't worry about diet. I mean, I've heard people tell me those stories that their doctors have told them of like, yeah,
Yep.
diet and exercise is hard. Just take this pill and you'll be
Yep.
fine. And that was honestly one of always my biggest complaints against exogenous ketones when they hit the mainstream market. When I was in grad school back in like 2015, I was working in a lab that we were doing a lot of research with exogenous ketones, and this was right before there were any on the market. I don't think there were. I think a year later is when like the first one really hit like kind of direct to consumer that you could purchase it.
Mm.
And when I was going through at that point, like reading some of the early research, and it was animal research, but some of that early research coming out of Dr. Dom's lab, What I was seeing in the lab that I was working in, it was like, wow, these things are exciting. This could be a great complement to a ketogenic diet, right? Like, and that was always the thought of like, oh, these might be able to help you achieve. And back then, this was before we were thinking about psychiatry, but it was, we were wondering if there was an optimal dose for anything, right? If maybe it's just cognitive function or, exercise performance, endurance performance, this could be a way for you to kind of figure out how to get to that spot. And then as soon as those things hit mainstream market, it was, this is for weight loss and you don't have to follow a ketogenic diet. And,
Yeah.
we realized very quickly that that's not the case. I mean, you can under no circumstances eat a standard American diet, take exogenous ketones and think you're going to lose weight. It just doesn't work like that. But you do bring up a really great point of, you'd be missing out on some of these other things, which, if we don't understand the full mechanisms behind how a ketogenic diet can actually help with psychiatry, then who knows what else we'd be missing out on. And the one that I kind of want to ask you about specifically is the role in gut health, because I know, I forget which study it was. I think maybe it was the military study out of Volek's lab back in like 2016 or 2018 that was looking at PTSD.
Mm.
And the thought there was that maybe it was a change in gut microbiome that was allowing the ketogenic diet to kind of inflict some of its benefits for PTSD. Do you think that the gut is also playing a role with psychiatry? Gut brain axis, there's all this talk about it. What role is that playing?
It's gut brain axis is a very popular topic right now. And I think there's no question it is involved. For me, the question is it the driver or the follower?
Mm-hmm.
Changing your diet in so many different ways is going to change your gut microbiome, and just improving diet quality, getting the processed stuff out, getting the whole foods in is going to improve your gut microbiome. Now, is it the gut microbiome that's having the direct effect, or is it the improved diet, right? Is it the ketosis and the improved metabolic health, or is it the gut microbiome changes? And it's likely all related. So, you can see how you would design the experiment. You change the microbiome without changing the diet or the metabolic health and see what happens. Or you change the diet without changing the gut microbiome somehow, keeping it constant. Those are hard studies to do. So I don't know if we're ever going to truly know the true answer. But I think the thing is, you find what works. And if nutritional ketosis is what works, it's going to work by improving metabolic health. It's going to work by having ketones for fuel. And maybe it works by improving the gut microbiome as well. So there could be 3 different ways that it works. So there's the research questions of which one is it, and then there's the clinical question of just do it and you're going to get better,
Right.
and you're going to feel better. Let the researchers figure everything else out. And that's where we come down to, how do we help people now versus what are we going to learn in the next 10, 20, 30 years? And so at Metabolic Mind, a big part of our focus is, how do we help people now? And then Bazooki Brain Research Fund, a big part of our focus is, let's do the research and figure out what all is involved. So it's kind of both wheels spinning at the same time.
Yeah, and I think that's a brilliant way to look at it, because it's not like, keto is this new thing that we're unsure of its safety. So, rolling it out while you're still figuring out the mechanisms is irresponsible in any way. Like, we know that it's a safe diet. We know that it's, even if it was doing nothing for your psychiatric health, it's helping your metabolic health, and which, you can't necessarily separate the two, as we now know, but you're getting all of these other benefits, and, you're not having any sort of risk with it, or any major risk at least. So it makes sense to kind of do it that way. And I think it's, if you look at, you highlighted all of these benefits behind keto, and it makes sense that it's got to be multifaceted if we really do care about the mechanisms and we want to know. I mean, obviously ketones have to be playing a role. We know all of the amazing things that happen in the brain when your brain is metabolizing ketones, from the increased energy, from the, decrease in neuroinflammation. So we know all of those things are going on. And then, if you're removing, like you said, you're removing processed foods, your gut health is getting better. Whether or not that's a direct driver, we do know that gut health is playing some role in how your brain is functioning. So if you see improvement there, you would think that you're going to see some improvement in the brain. If you had to, kind of if you hypothetical, or if you just wanted to kind of guess, is there any other mechanisms that you think could be at play outside of ketosis and just the general cleaning up of your diet? Is there anything else that you speculate would be interesting? Like, let's say you have unlimited funding, you can do, 1,000 trials. What would be some things that you would want to look at that would say, maybe this is why we're seeing the benefit?
Yeah, I mean, is it, not having glucose swings up and down? Is it having lower insulin levels? Is it,
Mm.
I'd love to be able to directly measure mitochondrial function and mitogenesis, as Dr. Chris Palmer talks a lot about. I think those would be really interesting to monitor. Um, compare it to a diet, just getting rid of processed foods and just eating healthier to see what the difference is. And that's why, if we do eventually have randomized controlled trials, hopefully it's not against a standard American diet, but it's against a healthier version of a diet, because anything's going to be better compared to a standard American diet. So yeah, those types of things I would love to see with more money, more time, more interested researchers. And fortunately, we are seeing a lot of researchers take note and see the potential here for very, very sort of elegant and impactful research studies. And that's what I love. I don't want science for science sake. I want science that's going to directly impact the care of individuals and helping individuals live better lives. So that's what we're looking to fund, and looking for other funders to help us with, right? Because the researchers are there. We need to get more and more money there to help have bigger and better trials.
Yeah. So if you're listening to this podcast and you have a big bank account that you don't know what to do with, you
Hmm.
can hit up Dr. Scher, and he can help you direct that in the right place.
Yeah.
You mentioned Dr. Eid, and I remember listening to her talk a few years ago at it's been actually more than a few years ago now, at a conference, about some of the benefits that she was seeing with like a carnivore diet, for more like autoimmune conditions, but then some of the mental health things that we know are kind of correlated with autoimmunity, like anxiety and depression and things like that. What do you think about the different modalities of getting in ketosis, like intermittent fast, like, and we'll say diet specific. We won't introduce exogenous ketones into this, but like
Yeah.
intermittent fasting versus a ketogenic diet versus carnivore. Do you think there's any one that maybe has a better benefit, or that brings something else to the table that could be beneficial for psychiatric conditions?
Yeah, it's a great question, and the answer is, I'm guessing. It's hypothesis. We don't have the studies to guide us, but you know, the first answer is whatever's going to get somebody there and keep them there. Like, some people just don't do well eating plants, and that's hard to say for a cardiologist who's been telling people to eat plants forever. And me personally, I love, if I would have a hard time personally going completely carnivore, I think, because I really enjoy broccoli and Brussels sprouts and cabbage and cauliflower. Like, I really enjoy that, but I know some people just feel terrible when they eat it, and that's their body telling them something. So for those people, absolutely, a carnivore diet probably makes more sense. Or for people who are seeing benefits on keto but want to experiment to see if they can see even more benefits a different way, that's where I'll put a lot of my patients on a carnivore diet as an experiment to see what makes a difference. And you know the knock against plants and nuts, the anti-nutrients, the phytates, the oxalates, all of that comes from the basis of some reality. But the question is, how big of a problem is it, and for whom? And for some people, it's a bigger problem than for others. And this is, part when you're dealing with more clinical experience than research, it's hard to really put a finger on all these things. So a lot of it is sort of individual experimentation. And that's where, putting my clinician hat on for the patients I see, this is where I really want to design little N of one experiments to test. And this is where it's really helpful to work with an experienced clinician, to help guide you through these N of one experiments. And it doesn't always have to be a physician. It could be a health coach. It could be a dietitian, just someone who can help guide you, who has the experience and the knowledge and can work with your physician to make sure it's done safely and appropriately. I mean, that's sort of it's the fun part of medicine, really, when you're trying to, be a detective and put together a puzzle. Although for a very busy, overworked physician who doesn't have time for this kind of thing, it's not so much fun. And that's the problem we're in, sort of, with our medical structure and medical community versus, what should be an inherent curiosity, an inherent desire to do whatever you can to help the person in front of you. Our system is not set up for that, unfortunately. And that's something that really has to change.
Yeah, I agree. And I think that, regardless of what we find as the answer to why it works or what the best modality is we're going to find out that it's got to be personalized, right? It's got to be tailored, specifically to the individual. And I do want to dive a little bit into kind of like the healthcare side of things, because I think that that is important. Like, how do we actually position, so that we can actually take care of these people? Like, what is the relationship between physicians and dietitians and nutritionists and all of those things. But I do want to ask another question on the kind of the carnivore topic. Is do you see any sort of relationship between autoimmunity and psychiatric conditions? Because I think the biggest potential benefit of a carnivore diet, like you mentioned, not everybody has an issue with plants, but it does seem that people who have autoimmune conditions do tend to have a little bit more of an issue with plants, especially certain ones. So do you see a relationship between the two, where people with psychiatric conditions also have kind of some form of autoimmunity, or what are you seeing there?
Yeah, I mean, I think it certainly makes sense that those two would coexist.
Hmm.
Autoimmunity creates inflammation in different areas,
Right.
and so inflammation in the brain is a part of the mechanism of psychiatric conditions. It may not be the driving force in everybody, but I think it's clear there will be a subset of the population where autoimmunity plays a role, and this is where things like functional medicine can really kind of play a role there, because that's where you dig deeper to look for those people who have autoimmunity as a core of their problems. Now, the knock against functional medicine, which sometimes is true, is that if you test a million things, some of them are going to be abnormal. But how do you know if those are causing something clinical? Well, when done properly, when done in a purposeful and directed manner, you can find areas that are more likely to be contributing. So for someone, if that is autoimmunity, then maybe that is the person you would try on a carnivore diet, because that does seem, at least clinically and anecdotally, to be very beneficial for autoimmune conditions. So maybe you would try and find that subset of population to try that way. So I think it plays a role, but for some more than others. And the key is determining that. And again, I guess I sound like a broken record, but that's when it comes back to really working with a clinician who's going to think deeply and carefully about you as an individual, and has knowledge about nutritional therapies and how to start them and when.
Yeah, because what kind of comes to mind is that I could totally see a situation where somebody has a psychiatric condition and autoimmunity kind of going on simultaneously, and then maybe they don't respond as favorable to the ketogenic diet, if they're eating, let's say, a lot of nuts or a lot of certain plants that are high in some of these nutrients that maybe disproportionately affect folks with autoimmunity. So then the question is, what would happen to those folks? Like, would their psychiatrist just abandon the ketogenic diet? Like, it'd be great to
Right.
have kind of a protocol in place of like, all right, this is what we test first to figure out what is the optimal ketogenic diet or diet that gets you into ketosis that you should be following based on your kind of personal situation. Because even the ketogenic diet, I think one of the issues with the research that we see with keto is that there's not a standard protocol for keto,
Mhm.
right? I mean, keto can be a
Right.
lot of different things. Like, yes, we kind of have a general macronutrient recommendation that we make for people, but it's even that's, it's what about the foods that are actually contained within that? I can be eating 25% protein, 70% fat ketogenic diet, eating all chicken and olive oil, and you can be doing it with butter and red meat. You could be having seed oils. I could be not having seed oils. Like, those are two different things. What do you think about, looking at the different variations of keto, and kind of on the macronutrient side of things? Like, do you think for psychiatry and maybe with some of the experience that you have thus far, is this looking more like kind of the epilepsy version of keto, where it's like very low protein, a lot higher fat, or are you not really seeing a difference with that?
Yeah, I think in the psychiatry world right now, most of it is not that 4-to-1 keto diet. I mean, and that
Okay.
is an extreme short-term diet with, it's maybe got 7% of your calories from protein or even less. Like, that is not a long-term sustainable diet. That is meant to be a short-term epilepsy intervention. So it's mostly this, what's termed in the literature as a modified Atkins diet, where you really like don't even have to count so much, but you limit your carbs, and you get an adequate amount of protein in that like 1 to 1.2 grams per kilo range as a baseline, and then the rest is fat. Like, that's more sort of the commonplace keto diet, which is what I'm seeing, at least in both in the literature and in clinical experience, in psychiatry. And I think that makes more sense because, again, we're talking about a diet we want people to stick with long term, to continue to get the benefits of nutritional ketosis, of giving ketones to your brain long term. So it has to be sustainable. You have to get enough protein, because we don't want a whole bunch of sarcopenic people walking around just for the sake of ketosis, right? So I don't think we need to worry about that 4-to-1 keto diet anymore, but instead talk about the modified Atkins, more contemporary keto diet. But you bring up a very good point. Is it, all, seed oils and chicken, or is it, red meat and butter, or is it a combination of all of that? And there isn't a consistency. So I think in the beginning, we sort of have to say, let's just get people in ketosis, however they can get into ketosis nutritionally, make sure their metabolic health is improving, and then see how their psychiatric symptoms are improving, and then work on cleaning up the diet as best we can. But the first step is getting people there. And, it's part of this concept too about like, well, keto's too expensive, I can't do keto. Well, if you're going to only eat grass-fed ribeyes and wild salmon and the highest quality olive oil, yeah, keto's expensive. But if you're gonna, do the pork loin that's on sale and get some, maybe some omega-6 oils and, the plain eggs, not the pasture-raised eggs. Okay, that's a good place to start. That's going to be less expensive and get you into ketosis, and then see how you respond, and then you can sort of improve and clean up from there. But we set the bar too high, and we're going to exclude far too many people who can benefit if we take the stance that it's got to be grass-fed, it's got to be pasture-raised, it's got to be wild, it's got to be the cleanest in the world. Unfortunately, most people who can benefit from this aren't going to be able to afford that.
Yeah, that's such a great point, that it's not about optimizing. You don't have to have it optimized to start it, right? You can, especially if it sounds like, we speculate that the majority of the benefit is coming from the ketones. So getting somebody in ketosis by whatever means necessary is probably a great first step. And then finding ways to optimize from there, is going to work. And the reason why I had asked about like the protein side of it is because, I know, we now know that like muscle is a very metabolic organ.
Yep.
It plays a huge role in glucose disposal. Has the mitochondria and muscle are extremely beneficial to our metabolic health. So that's always a wonder that I had of like, okay, if we, we see, I think it was a study published in like 2018 that was looking at it wasn't a psychiatric population, but just a general population of people following a ketogenic diet. I think it was 25% protein and doing resistance training. And a lot of those folks lost muscle, right? Because they just probably weren't meeting their protein demands in relation to their exercise. And I would assume too that exercise, and maybe that's a question that I have too, is what role does exercise play in some of these psychiatric conditions? But, if we have these people who are, losing muscle, then we would assume that they're not going to be optimizing the improvements in their metabolic health. So we'd want to mitigate that to some degree. So then you wonder, okay, but how does that affect, the version of keto that they need to be following for their actual brain? I think that's a question that I would have, but it's like you said, it's not about necessarily optimizing it at the start. It's about getting people into ketosis and experimenting, because likely it's going to be different from everybody. I mean, I know people that have followed the traditional like 15-20% protein keto diet and have gained muscle on it, and they've done fine, or at least not lost muscle doing it. So it's not like everybody's going to lose muscle going that route, but it seems like there is probably some personalization there. What about exercise? Oh, go ahead.
Yeah, I was going to say, I think in a perfect world, everybody would be getting, this like 1.6 grams per kilo of highly
Mm-hmm.
bioavailable protein and doing resistance training. But I think if you're starting a keto diet for a psychiatric illness, maybe it is better to start at 1 gram per kilo to make sure you're getting the maximum benefits, and then slowly titrate up your protein for the longer term muscle and metabolic benefits. Like that is a certain approach. So, but I agree. I think the optimal is around that 1.6, but that doesn't mean you have to start there. Yeah.
Yeah.
So sorry, I interrupted your question though, please.
No, you're good. Well, I think I'm actually going to take it a different direction, because you've kind of teed up that pretty well. So we look at, it sounds like there's so much personalization that is going to be required for this. And as you've highlighted, our current healthcare system just doesn't really allow for doctors to be able to provide that same level of care. So, let's say 5 years down the road, or, that's an arbitrary number, but 5 years down the road, we have plenty of research. We know that ketosis is beneficial, and we know kind of the optimal level to get them to, but we also know that everybody's a little bit different and that they're going to require some personalization. How do we have a healthcare system that's able to accommodate that? Is
Yeah.
it a matter of having more psychiatrists? Is it a matter of kind of bringing people from different disciplines together, like psychiatrists and dietitians, and allowing them to kind of have an integrative approach? Like, what do you see as the path forward that will allow? Because we know for a lot of things, like type 2 diabetes, for instance, like we know a pretty clear path for people to reverse or better manage their type 2 diabetes, but it doesn't mean that it's very easy for them to do it or that they can get the proper care. So what does that healthcare system look like?
I think type 2 diabetes is the perfect example of what the healthcare system should look like. And what's happening in type 2 diabetes, Virta Health is leading the way to get insurance coverage of a behavior change module, the app, the coaching, the physician supervision, even if you're not the treating physician, but having that covered by insurance or covered by an employer. So the physician doesn't have to do it. I do not ever envision a world where the psychiatrist is going to sit down with their patients and say, here's what you shop for. Here are the recipes you want to cook. I
Yeah.
don't ever envision that. But I do completely envision the psychiatrist saying, I think a nutritional ketosis intervention is going to be beneficial for you. Here is the group covered by your insurance. That is an app-based group with coaching and dietitians who is going to help you learn how to implement this, how to do it safely, and is going to directly communicate with me as your physician to make sure you're doing this safely and your medications are appropriately adjusted. That's where I see this going. And I don't think we're far off. I think we're getting there because of the examples we're seeing in type 2 diabetes and metabolic health that are starting to get covered by insurance, that are starting to get paid for by employers, and the dramatic benefits people are seeing. So if it can happen in type 2 diabetes, it can happen for PCOS, it can happen for cancer therapy, it can happen for mental illness, it can happen for a broader range of medical interventions, where I think it should in all those areas.
Yeah, I totally agree. I mean, that's, I've talked to a couple of my professors when I was in grad school were out of Brazil. And, one of the things that they had told me was that, in Brazil, nutritionists and dietitians are kind of viewed as beneficial or as knowledgeable as physicians are, right? And they're kind of on that same pedestal. And there actually is a lot of interplay between the two. Whereas in the United States, we don't see that. I think, and it may be a result of us not really having like a unified nutrition body. Like there's not really like one play, and it would be nearly impossible for us to come up with it because nobody's going to agree on the best dietary practices to be able to put together this kind of like broad curriculum for people to follow. But there's a lot of there's really good nutrition certifications out there, and then there's really poor ones. And you can go to a school that I happened to go to a school when I got my master's in nutrition that was really cutting edge and that was studying a ketogenic diet and taught me a lot of new things. But a lot of people aren't doing that. Like a lot of times you're going and you're getting kind of the same story that's been told for the last 20, 30 years. So, I think that's why in our society here in the US, we don't view, unless you're a registered dietitian, we don't really view that as like you having like a lot to bring to the table sometimes, which I don't think is great, is the right way to look at it, because it really comes down to, what do you know is what's most important. Like I'll get people to ask me all the time, like, where should I go get my nutrition certification? I was just like, well, you should go, if you need one, go get one, but then you need to do your own research if you want to know what
Yes.
to do, because you're not going to get it, from very many of these governing bodies that are out there.
Yeah.
But yeah, I think that there has to be a relationship between the two. Like I think that, and I know what is it, LJ Amaral, who we've had on the podcast. She works with Cedar Sinai, and she's the nutritionist there doing everything for their cancer programs. And she's a registered dietitian. They send their patients to her to come up with the protocols that they follow, that they'll have them follow for their cancer treatment. And that's how it should go. Like that, there needs to be. We can't expect. I think a lot of times we put a lot of pressure on physicians as a whole. And I've been guilty of it too. You talk about how little nutrition schooling these physicians get when they're going through, and you're cardiologists, you know this as well. And then we kind of act like it's their responsibility to be able to do that. But that's like wanting your car mechanic to fix your pool. Like it's just, those are two different things, right? Like we can't expect them to be a master of all things. So I think it really does come down to us, being able to kind of bring those together and have a relationship between your personal trainer and your nutritionist and your physician, so that there's kind of a well-rounded approach to your care.
Yeah, I think you hit the nail on the head there. And um, when doctors tell you to exercise, they don't know how to give you an exercise prescription. They have
Yeah.
no idea what to tell you, right? So exactly, same sort of thing, to have a coach or a personal trainer or someone with that experience to lean on, or again, an app-based service that's going to help you learn how to eat better, learn how to move your body better, learn how to prioritize sleep better, because the doctor is not going to tell you about all that. Like, you know,
Mhm.
a number of years ago, I went and got trained as a personal trainer. I went and got a nutrition certification. And my colleagues thought I was crazy. They're like, why are you doing that? You don't need to know that as a physician. I thought they were crazy that they don't, that, we just did not see eye to eye. But I think the majority of the physicians think that that's not my job. My job is helping my patient get better however I can, but not everybody's going to have the time or the ability to do that. And that's where we're going to need to definitely have a combined, cohesive teamwork approach to really help people get better. And a way that's not super expensive. If you want to pay $500 a month, you could get that now. But who's got that
Right.
money, right? Who can pay
Right.
$500 a month for that right now? So we have to get it so we can scale it. It can be less expensive, and it can really help a lot of people.
Yeah. What is kind of the biggest limiting factor behind getting this type of care covered by insurance providers? Is it just simply having more evidence, like the research that you guys are working on, getting more of that? Or what is kind of what's going to be necessary to, because I think you're right. Like, yeah, you can go get that level of care now, but unless you have a lot of disposable income, you're not really going to be able to afford doing that. So
Yeah.
the insurance piece of it is a big piece of the puzzle. So what do we need to get it to that point?
Yeah, I think we're going to need more research showing better outcomes and decreased costs. That's going to be the key.
Mhm.
Because, I mean, let's face it, insurance companies,
Yeah.
they're businesses, right? Do they want you to be healthy or do they want to spend less money? Well, you can argue, right? But they have stockholders they need to listen to. So they need to make a profit. They need it to be less expensive. So it can't worsen care and be less, worsen outcomes and be less expensive. That's not going to fly. But if it can improve outcomes and be less expensive, that's what they need to see. Now, what's interesting is the middle ground before insurance companies are large companies, self-insurers. They aren't necessarily going to play by the same rules as insurance companies in terms of the amount of evidence that's needed. They can go on a hunch. They can take more of a risk and be like, look, I really think this is going to work. There's some signal out there that it's going to decrease our costs and improve the health of our workers. Let's do it. So I think maybe the companies might lead the way, and then there might be like one insurance company that catches on and says we're going to try that, and then I think other insurance companies will start to follow, especially if the research is starting to catch up. So I kind of think that's the progress, the way to do it. But I really hope we get there soon, because there are so many people who can benefit from this who aren't now. And at Metabolic Mind, we can do so much to try and put the information out there and help people learn, but they still need help putting the pieces of the puzzle together. And that's what we would love to help see happen also.
Yeah, well, I think you guys are doing an incredible job of it. I mean, awareness really is the big step. Like, a year ago, no, this concept, and I see it all over the internet now of, mental metabolic health is mental health. Nobody was saying that a year ago, right? Like maybe there was some small pockets of folks that were in the know that were talking about that, but that's become a broad term now that everybody's talking about, and that's incredible because that's driving the conversation in the right direction. People are now looking at mental health and psychiatric conditions through the correct lens of like what's the actual root cause that we should be
Yeah.
thinking about, whether that's with a pharmaceutical, whether that's with a dietary intervention, whatever it is. There's probably a lot of different ways that we can target that, but we have to at least be looking at the problem the right way, or at least force people to realize that the way we're currently looking at it isn't working. Because if you would ask, how not everybody knows somebody, outside of your anxiety, depression, everybody kind of knows somebody with those things, but not everybody has somebody in their life that's suffering from bipolar disorder or, schizophrenia or those things. So if you're not really, if you don't have that going on in your life, then you're not really thinking about it. So you don't even know that this is a condition in which our treatment is very poor for it. Our outcomes aren't great, and people end up worse off, when they go get treatment for it. So, well, I shouldn't say worse off, but they don't end up necessarily better when they go get treatment for
Right.
it. So
Right.
I think the awareness piece is really big. So, huge kudos to you guys and what you're doing there. Is there anything exciting in the pipeline there? Any, podcast or anything new coming out that you guys are going to be using to help spread that awareness?
Wow, we're doing so much. I mean, we actually have sort of a series coming up on eating disorders, which I think is super exciting
Yeah.
because, I mean, again, it's an area where current treatment is really poor and really does not help people live their highest functioning life, but also because any quote unquote restrictive diet is contraindicated in eating disorders. So a keto diet is thought of as contraindicated. But now what we're learning is used as a medical intervention, therapeutic nutritional ketosis can improve symptoms of eating disorders, even putting them into remission. And the science is catching up. There's a 5-person pilot study that we actually already did a podcast about. And now we're doing a couple individual experience podcasts. And we're going to start funding a larger study on eating disorders and nutritional ketosis. So that's, I
Wow.
think, a really exciting area. So when we talk about serious mental illness, we're talking about bipolar disorder, major depression, schizophrenia, schizoaffective disorder. But I think we can also add in there anorexia and other eating disorders, because the outcomes and the clinical outcomes and the dangers of those psychiatric conditions are enormous. So to
Mhm.
be able to improve people going through that and have them get back to their, quote unquote, normal functioning life, like we talked about earlier, I mean, that is just so dramatic. So that's one area I'm really excited about. Something
Yeah.
else I'm excited about is we have a couple of big conferences coming up. American Psychiatric Academy in American Psychiatry Academy in San Francisco, and actually the time of this recording is just in a few days. But then the ISBD Bipolar Disorder Conference in Chicago in June, where we're going to be hearing more about metabolic psychiatry, and we as Metabolic Mind are going to be there to help sort of educate people about this and meet more psychiatrists who are interested in this. So I'm really excited about that, and we'll just keep putting the information out there, sharing the research as it comes, and sharing the clinical and personal journeys, and like Jan said, helping people like her, helping people find the information that she was so desperate to find, and let them know that there's hope, and that this is a potential.
That's amazing. That's so great. And we'll make sure to link to, everything Metabolic Mind in the show notes so everybody can go check out all the great resources you're putting out there. I have to say it's really cool to see what you guys are doing and see, you've always been on the forefront of spreading the keto information and kind of helping grow that knowledge base and getting that out to more people. And then, you being a cardiologist, you provided so much authority behind that, Diet Doctor you worked at for years was one of the, I would say the ultimate source of keto information, and you being kind of one of the top guys behind that. And then now seeing you kind of shift to this other area is just amazing. Like, you have this incredible track record of being able to help push these movements that are really big and really important, and that require a lot of heavy lifting. So I'm really excited to see where this goes for you guys. And yeah, if there's anything that we can do at the Thinking Health podcast and anywhere else to help support this, like we are definitely in line with that. And I highly recommend everybody to go check out all of that content. If you guys haven't consumed any of Dr. Scher's content in the past before, incredible educator, as you guys have been able to tell from this podcast. So if you want to learn more about the stuff we're talking about, his videos are going to be a great place to go for that. So Dr. Scher, really appreciate you coming on and taking some time. And, I am going to have you back on, because as soon as you brought up some of the eating disorder stuff, I had about 20 more questions that popped into my head. So we're going to have a follow-up episode for that.
I'd be happy to. Thank you so much, Chris. I appreciate all the kind words you said, and the excellent questions. And it's been a really good discussion. And thank you for helping us sort of spread this message and spread the word.
You bet. Thank you.